Okay, so first of all, can I thank Queenslanders for masking up? This is really important. It was a recommendation out of AHPPC, and already you've seen some states move on this. It was great to speak to some hospitality staff yesterday, and they said to me that they don't mind having to wear a mask if it means that they can continue to operate over Christmas and New Year period. So it's going to be really important that with Omicron now out in our community, and as we enter the next phase of this pandemic, people need to think very carefully about when they're going into indoor settings to wear a mask, unless you are eating or drinking. I want everyone to stay safe over the Christmas and New Year period, but we will see an escalation of cases like we are seeing in other states. But the good news is that at the present time, there's only one person in hospital, and they have other medical issues, even though they do have COVID. But that is the only person who is in hospital at the moment. We have no one else in hospital who is sick with COVID. So today we have 369 new cases. These cases are going to escalate, and this virus is across Queensland. It is now in the Banana Shire, Brisbane, Bundaberg, Cairns, Central Queensland, Gold Coast, Gympie, Ipswich, Logan, Maranoa, Mareeba, Moreton Bay, Noosa, Redland, Southern Downs, Sunshine Coast, Toowoomba, Townsville and the Whitsundays. So we all have a responsibility now to make sure that we are wearing the mask. When you're outdoors, like we are here, it's fine. But when you are going indoors, please mask up to help prevent the spread of Omicron. Yesterday, Queensland Health did 13,108 vaccines and 33,761 tests in the last 24 hours. And in terms of vaccine coverage, we're now at 90.1%, at least one dose, and 85.36% are fully vaccinated. And in terms of boosters, thank you Queenslanders for going out now and getting your third dose. I had mine the other day, no problems whatsoever. We now have 121,455 Queenslanders that have received that booster. But when you are due, it is really important. I was speaking to a group of people last night too who were asking about when they can get their boosters. When you become eligible, please go and get that booster shot. We had a very good National Cabinet meeting yesterday in relation to how important the boosters are for added protection, but also too in mid-January we need to make sure that we get the children vaccinated in time to go back into the school year. So there are going to be a lot of people working in January to make sure that we increase the coverage of vaccines. So if you are unvaccinated, can I say now is the time to get vaccinated. The evidence is if you are unvaccinated, you could end up very, very sick in hospital. So please think carefully about that. And finally, can I just say we're on the beautiful Gold Coast, but I am still worried that the vaccine coverage is not high enough here on the Gold Coast, which is one of the reasons we're doing this press conference here today. Across the southeast of our state, essentially every area is above 90%, except the Gold Coast region. Even Logan, Ipswich, where we had a huge vaccine drive, they have now hit over 90%. In Brisbane, they're heading towards 95%. But on the Gold Coast, it's 88.8%. This is a tourism hotspot. This is where the tourists are coming from just across the border. If you have not been vaccinated, go and see your GP or your pharmacist or one of our vaccination centres today. It is absolutely imperative that we drive up the vaccination rates on the Gold Coast. And yesterday I gave a big shout out to Mackay, 94.2% first dose. Well done, Mackay, that is excellent. And Cairns is over 90% now, they're at 91.7%. I really need the Gold Coast to come out and step up, and if you have not got vaccinated, to get vaccinated, or we are going to see people ending up in the Gold Coast University Hospital who are unvaccinated. This virus is here. It is right through our community. We are living with this virus. This is the next stage of the pandemic. Everyone wants to get on with their lives, but we are going to see a big impact on those who are unvaccinated. So I might leave it there and hand over to the Chief Health Officer, and then we're happy to take some questions.